Hi, I am Dr. Manjunatha, working as additional psychiatry at Newman's, Bangalore. Today we will discuss about Triad of Medical Certifications, which often our medical books, especially Western-based medical books, doesn't have information on this. We are the medical doctors are comfortable in diagnosing and treating illness in our patient because we have tried to do it. But one of the discomfortable area for medical doctor is issuing a medical certificate because we are not trained adequately during our medical educations. Another reason is that we often read Western book which lacks our need in India. And other major fear is that medical legal aspect of the issuing certificate. Hence, I am proposing the Triad of Medical Certificate where all kind of certification requests can be covered in this triad, based on my 32 years of experience in medicine and 23 years of experience in psychiatry. And this proposal, I believe, it will be simplify the concept of medical certifications. This only three area where medical certificates are being requested and demanded kind of things. It is one is illness related certificates, another is a disability related certificate and ability related certificate. As I said earlier, we read, train and are comfortable illness. Disability is the another area where we are not really comfortable because it's one of the social concept. But often all governments are giving their guidelines to follow for the disability of the particular illnesses. Coming to ability, there is no guidelines in India. That is where we are not really comfortable. And most of the times, ability certificate is the area where we land up in the issue and we read it in newspaper and all. Many area it becomes a controversial. Let me just give you a little bit more. Triad of the medical certificate, as I said, sickness or illness related certificates. We issue illness certificate. We issue treatment certificate. Another certificate which we issue is the leave certificate, which is a dysfunction related certificate. Maybe even leave is a very few days to 1 day, 2 day, 4 day, 5 days kind of thing. And disability certificate also comes under dysfunction related certificate. Coming to ability related certificate, I would call as a functionality related certificate also, and I also call as a fitness certificate. This is the one area where it is based on specific task or purpose of the individual where illness is present. So as I said, it is a functionality or ability or fitness related certification is the one domain where it is a lot of controversy are there, and majority of the time doctors are not comfortable. We need to understand this. As I said, it is based on specific task and purpose of the individual. Despite presence of illness or disability, many functional ability of the individual may remain intact. This is where we need to understand. So often, fitness is often questioned solely based on the existence of illness or disability, even in specific area of the questions are preserved. So for example, fitness for job, even in schizophrenia patients can do MBBS in my opinion. So where just because of presence of the schizophrenia or just because of presence of the disability, we cannot exclude them from specific role of the individual. This these days people call as a discriminatory FIDO. So hence now all doctors need to understand whether this fitness or ability is still present when despite having illness or despite having ability. This is the one area we all need to be comfortable in the present area and future. Please share your comment in this section. Please like, share, subscribe for this kind of brainstorming videos. Thank you very much.